Magandang araw po sa inyong lahat. Ako po si Romeo Pilayo. Nagbabalik sa aking channel. Doon po sa mga nag-fill up ng DOLE AKAP Financial Assistance, I believe na receive nyo na po yung $200. At doon sa mga hindi pa nakakatanggap, pwede po kayong mag-email sa doleacap.ncr@owa.gov.ph. Ngayon po ay pag-usapan natin ang tungkol sa Philhealth high premiums upang malaman natin at ang mga pangyayari at subaybayan niyo po ako until the end of this story. The President decided not to impose additional burden to OFWs, especially now that there's a lot of them being repatriated or lost their jobs. Roque said in his regular press briefing, adding that membership can be voluntary for now. Ang ibig sabihin nito, ang mga seaman, ang mga OFWs na aalis at nagpa-process sa POEA ay hindi na kailangan na magbigay ng resibo na nagbayad sa Philhealth para makakuha ng OEC. So dito na po tayo sa Republic Act 11223. An act instituting universal health care for all Filipinos, prescribing reforms in the healthcare system, and appropriating funds therefore. Those chapter 1's general provisions, it says that an integrated and comprehensive approach to ensure that all Filipinos are health literate, provided with healthy living conditions and protected from hazards and risks that could affect their health. A healthcare model that provides all Filipinos access to a comprehensive set of quality and cost-effective, promotive, preventive, curative, rehabilitative, and palliative health services without causing financial hardship and prioritizes the needs of the population who cannot afford such services. So, maraming provisions, maraming explanations, pero hindi ko na po iisa-isahin. So, pwede nyo bang basahin ang kabuuan? Gusto ko lang pong malaman nyo na yung ginawa ng implementation ng Philhealth ay binase nila dito. So kung makikita nyo ito, direct contributors refer to those who have the capacity to pay premiums, are gainfully employed, and are bound by an employer-employee relationship, or are self-earning professional practitioners, migrant workers, including their qualified dependents and lifetime members. So, kinopya lang. Bali, kinuha lang talaga rito sa Universal Health Care. Kasi yan, no, malinaw. Migrant workers, which means OFWs, yung mga nagtatrabaho sa abroad. So page 3, Universal Healthcare, Chapter 2. Every Filipino citizen shall be automatically included into the NHIP, herein after referred to as the program. So, ang coverage Every Filipino shall be granted immediate eligibility and access to preventive, promotive, curative, rehabilitative, and palliative care of medical, dental, mental, and emergency health services delivered either as population-based or individual-based health services. So, ito na yung nilagay dun sa Philhealth Advisory. Philhealth shall provide additional program benefits for direct contributors where applicable, provided that failure to pay premiums shall not prevent the enjoyment of any program benefits. Provided further that the employers and self-employed direct contributors shall be required to pay all missed contributions with an interest. Ito yung masakit. Compounded monthly of at least, ito yung masakit. Compounded monthly of at least 3% for employers and not exceeding 1.5% for self-earning professional practitioners and migrant workers. Ang Section 10 ng Universal Healthcare pertains to premium contributions. So, for direct contributors, premium rates shall be in accordance with the following schedule and monthly income floor and ceiling. So, may income ceiling, ang ibig sabihin kung kumikita ka ng 70,000, 80, 90, 100, 150, or 200,000 sa 2019, ang basis mo pa rin ay 50,000 lang. So, sa 2020, 60,000, sa 2021, 70,000, and next years thereafter until 2025, 100,000. Ganon din yung premium rates, started with 2.75 until 2025, 5%. Ang ibig sabihin, there is an increase of 0.5% every year. So, dito na tayo sa Section 11, Program Reserve Funds. Philhealth shall set aside a portion of its accumulated revenues not needed to meet the cost of the current year's expenditures as reserve funds. Any unused portion of the reserve funds that is not needed to meet the current expenditure obligations or support the above-mentioned program shall be placed in investments to earn an average annual income at prevailing rates of interest and shall be referred to as the investment reserve fund. So, maraming paglalagyan yung pera na ang ibig sabihin, sobra doon sa expenditures. So, anong gagawin sa sobrang pera? So, siyempre, investments para kumita. Yun lang ang gagawin nila. So, dito naman tayo sa Section 13, Philhealth Board of Directors. The Philhealth Board of Directors, after referred to as the board, is hereby reconstituted to have a maximum of 13 members, consisting of the following 5 ex officio members, namely the Secretary of Health, Secretary of Social Welfare and Development, Secretary of Budget and Management, Secretary of Finance, Secretary of Labor and Employment. So it's a collaboration of 5 departments ng government. In addition, there are also expert panel members with expertise in public health, management, finance, and health economics. And also 5 sectoral panel members representing the direct contributors, indirect contributors, employers group, healthcare providers to be endorsed by their national associations of healthcare institutions and healthcare professionals. So, and also the Secretary of Health shall be an ex officio non-voting chairperson of the board. So, ginawa ito para for the sake of transparency. So, para makontrol, maiwasan ang corruption. The universal health care was approved on February 20, 2019 by Gloria Macapagal Arroyo, Speaker of the House of Representatives at the time, Vicente C. Soto III, President of the Senate, Dante Roberto P. Maling, Acting Secretary General, House of Representatives, Myra Marie D. Villarica, Secretary of the Senate, and the President of the Philippines himself, Rodrigo Roa Duterte. It says that this act shall take effect 15 days after its publication in the official gazette or in any newspaper of general circulation. Philhealth premium rates that took effect December 7 or 15 days after the publication of its circular 2019-009, which was suspended. So if you look at 2020, the threshold or the income ceiling is 60,000, 3%, 1,800, so 21,600 doon sa mga sumisweldo ng above 60,000. Kasi ang ceiling nga is 60,000 lang. So kada buwan, kada taon, may 0.5 na karagdagan, 0.5, 0.5, hanggang sa umabot sa year 24-25 na ang babayaran at ang ceiling ay naging 100,000. So 5,000 ang monthly premium multiplied by 12 months, 60,000 ang babayaran. So, mag-sample tayo ng computation for year 2020 based on new Philhealth premium rate. So, kunin natin ang conversion rates ng dollar, $1 equivalent to 50, which is average, and Saudi Arabia riyal 50. So, ang basic salary ng isang OFW ay 1,000, so 50,000, multiply mo yun sa 3%, magiging 1,500, multiply sa 12 months, so 18,500. Ang sabi, kailangan may initial payment daw na 2,400 prior to issuance of EOC. So amount to be paid in 2 quarters is 16,100. Sa sample naman natin dito sa Saudi Arabia Riyal, ang isang OFW na nagsisweldo ng 1,800, ang equivalent yun is 24,300 multiply by 3% per month rate, 729 multiply by 12 months is equals 8,748. So may initial payment na 2,004 prior to issuance of OEC. Amount to be paid in 2 quarters, 6,348. So, 2.3 million ang OFWs, estimated lang, no? And then let's assume we have estimated 400,000 na seafarers. So, 75%, pagpalagay natin the earning more than the threshold or above the income ceiling. So the computation will be as follows. Basic salary niya is 1,200 multiplied by 50 pesos equals 60,000 pesos multiplied by 3% equals 1,800. So multiplied by 12 months, bali sa isang taon, ang babayaran ng isang OFW ay 21,600. I-multiply natin ang 21,600 per year premium sa 300,000 na seaman. The total would be 6.4 billion pesos. Imagine if all OFWs mandatorily pay the Philhealth premium, sobrang laki ng koleksyon. Accordingly, I leave it to you to calculate. You got the glimpse of the universal healthcare law. The question now is for how long the Philhealth increase in rate suspension or postponement will last. Don't forget to subscribe to my channel and make sure you hit the subscribe button and hit the bell. Thank you very much for watching. Ciao for now.